changes, I guess, with every patient that you see, every room you go in. I've been doing the stress management thing for about 35 years or so. And I've come up with my own definition of stress. And it's anything to which you have to adapt to a change. And that's pretty much life, isn't it? Because every day we have to adapt, we have to change, we have to change how we think, how we feel. Sometimes we have to change the direction that we're driving to work in. With every patient you deal with or every medical situation you're in, you have to adapt to that or change your pace, change something within yourself. So you also know that stress is positive and negative, right? So there's negative forms of stress, there's positive forms of stress. But inside we react all the same. You know, we still have elevation in heart rate, respiration, blood pressure, and so our brains don't make a distinction of what that is. Our body chemistry reacts the same whether we've been told bad news or good news. So I wanted to get a little help from you. How do you relax? What do you do now to come down, to relax, to make yourself feel better about what's going on during the day? Wait.
We need the microphone.
Okay. Now what did you say? Oh, listen to music. Okay, what else? What? Anyone?
Pray.
Pray, okay. Anyone else? Read, okay.
Walk. I probably do what most people don't do. I record, I hate to say the talk, you know, they're not very nice, but I know I'm going to get that in the evening and calm down and listen to
Oh, okay. So what are some other things that you do? Some of them are calming. Yes?
I breathe.
Breathe, okay. We're going to do some of that. What else? Walking is good. So you see that people, anybody else have one they want to share? Is what? Tell everybody.
I bring my dog to work every now and then.
Oh, that's good.
It's really good. I like that one.
You must have a well-behaved dog. Okay. What else?
I watch the older movies. Older movies, they're just calming.
Oh, older movies are calming. Okay. So some people have active forms of relaxation. Some people have passive forms of relaxation. This next question, you're all going to say, "Oh, she finally lost it." But do you know how to breathe?
Yes.
Do you breathe during the day? Do you know when you're not breathing? Okay. When do you not breathe? When you get all tight and tense, when things start happening? I got two microphones going. So let's practice some breathing. I have found in people that I work with that when we're under a lot of distress, which is the negative stress, or even people that are joyful, that have had a lot of good news, and that's eustress, that we tend to not breathe correctly. But one of the best things you can do during the day, on the job, like the little brochure says, to teach you how to de-stress, is to take a deep breath and let it out. You know, breathing from here, not from here. Okay? So let's breathe. So take a deep breath and let it out. Take another deep breath and let it out. Good. Now just breathe normally. Now, another exercise that you can do just on the spot, right in the middle of your day, when things are going hectic all around you and you're feeling that pressure, is to think about a time that you were really happy. Or think about a time that something really good was going on in your life. Or to come back to a center You know how to center yourself inside yourself? You bring that calm to the center of your being. Can you do that now? Just bring the calm into the center of where you consider the center of your being. Sometimes it's in the heart, sometimes it's in the stomach. And just imagine yourself centered. Everything's in balance. Okay, good. All right. Can I have a volunteer, please? Okay. Oh, she's going to come. Great. Okay, what's your name? Austin? Turn around this way. Tell everybody your name. Austin, okay. Now, I'm going to have you put your arm out. Now, this is real. This is not a gimmick, okay? Y'all have seen this before, right? How many of you have seen this before? Have you done it? Okay. I'm going to put your arm out like this now. I don't want you to let me push your arm down, okay? Okay. I want you to think of something really, really, really positive. Close down your eyes. You don't have to tell us what it is. Make a fist, okay? Now hold your arm really still. Don't let me push your arm down. I want you to think of some time in your life that was fantastic. Something really, really, really joyful and happy. Or maybe someone that you really have an affection for. Okay, great. Okay, now don't let me push your arm down. Hold it up. Out straight, really strong. She's really strong. Okay, okay. Take that out. Let it go. Okay, now, what do you want? The mini. Okay, good. All right, we're going to do this again. Are you a nurse there? Okay. Okay, put your arm out again. Fist again. Okay. Close down your eyes. Good. Now, I want you to think of something that's not so pleasant. Something that's negative. Maybe something that happened in your life, or maybe someone you just don't like. Got it? Okay, so let me push this down. Okay, wait a minute. What happened? Want to do it again? Maybe. Okay, don't let me push this down. Okay, got it? That really negative thing? Oops. It just goes down. Okay, thank you for your help. Oh, wait, for that.
Get back to joy.
Okay, get rid of that other memory. Okay, you strong? Good, okay. All right. So what happens is, even when our thoughts are positive, it gives us physical strength. When we eat good foods, it gives us physical strength. When we have negative thoughts, when we're around negative situations, or negative circumstances, when we absorb the energy from our patients, people come to us and complain or are upset or are sad, we absorb that energy. And then when you go home at night, how do you feel? I hear, tired, huh? You go home, do you ever go home tired and you don't know why? Or maybe sad and you don't know why? And it's because of all the energy that you've expended during the day with people. Okay. So, let me teach you a little. Do any of you do meditation or imagery? Okay, this will be easy for you then. Let's put down your pens and papers, get in a comfortable position, and I'm going to teach you a technique that you can use for yourself. And this time, it's going to be kind of drawn out, but you can actually use this with your patients, and I'm going to tell you how to do that in just a little bit. But this is called guided meditation or guided imagery. And I'm just going to guide you through some thoughts. And if you're good at making images in your mind, then you'll see these pictures clearly. If you're auditory and you learn by hearing things, then, or kinesthetic, you can tell yourself something about it, you can get a feeling about it. Whatever works for you. Okay? So close down your eyes. I'm not going to be doing anything to look at me. Take a deep breath and let it out. Take another deep breath and let it out slowly, slowly, slowly. And breathe normally. Now get in touch with maybe a memory that's a very pleasant memory for you, or a place that you've been to or would like to go to. Maybe it's just a picture in a magazine that you've seen. Or it may be something unreal like floating on a cloud. Maybe it's one of the most happiest times in your life. Or maybe it's a little prayer or something that you just say over and over to yourself at times that you need that strength. Whatever it is, notice every single thing about it. The way it looks. All the colors. All the details of whatever it is. Is there movement there? Can you be alone there? Is there other people? What are the sounds? What are the smells? Make it exactly as you want it to be, because this is a place that you're going to go in your mind when all around you seems to be hectic and distressful. Place that you can pull up in your mind that you never forget. And you can go back there anytime you want. You don't really have to close your eyes and get there. All you have to do is take a deep breath and remember. Notice how your body feels when you're in this place or in this memory. Calm and relaxed. Quiet and still. Blocking out all distractions, all other thoughts, and letting yourself be there, or remember it fully, or telling yourself whatever you need to. Become calm and relaxed. Let your breathing be normal and unhurried. knowing that you can go back to this place or back to this memory anytime you want, you will need to take a deep breath, and it will come back. And your body will calm, and your mind will calm. And you've taken a mini moment towards making yourself healthier and stronger and less likely to get ill in the future. And so getting ready now to come back to this time and this moment, take another deep cleansing breath and let it out slowly, slowly, and as you let your breath out, slowly open your eyes and come back to this moment. Good. Okay. Everybody was really quiet. I thought, gee, they just had lunch. I hope I didn't lose them. Okay. Anybody want to share? Anybody have something that they think was especially wonderful that they think would help someone else? Did you go someplace in your mind, or did you have a memory? What worked for you? What do you feel in your body right now? Relax. Okay. Muscles are relaxed. You know, you can do this with patience because the imagery and the relaxation you can create by the words you use in talking to people. I'll tell you a quick story. I was director of a psychiatric unit in a hospital locally, and they would always call me to the emergency room, but oftentimes they call me to recovery, people coming out of surgery. And there was this one incident that I remember because this man did not want to go back to his room. He came out of surgery, everything was fine, and yet the nurses said he won't wake up. And they said, we know he's awake, but when we say, are you ready to go back to your room, he acts like he's not awake yet. So they told me what had happened, and he was afraid of the test results. So the longer he prolonged it, the more he got to stay in what he thought was a really safe area. So at the time, the recovery room had these beautiful murals on the wall that we had put up. They were wallpaper that's a scene, you know, and where he was lying, there was a beautiful scene of a lake, a great big lake with kind of hills in the distance and trees and flowers all around. And there was a little boat kind of docked off on a far shore. And so I went over and talked to him a little bit, and I said, what do you like to do best? He didn't say anything. And I said, if there's someplace you could be right now, where would it be? And he whispered, fishing with my son. So I thought, oh good, I was hoping he would say something. So I said, well, you're turned on your left side, and if you open your eyes just a little bit, you can look at the wall. See, it has that pretty body of water and those hills. Yeah. And I said, so what does that remind you of? He didn't say anything. I said, imagine right now that you're not here in this place. You're maybe with your son. And you're in that little boat over there on the far shore. And you're going to have a whole day of fishing out on this beautiful lake. He started shaking his head. And I said, don't you think that the sooner you get out of here, you can make that happen. And he took a deep breath, and I said, that's a good start. Take a good deep breath, and then start thinking about in your mind when the next time would be a good time to go fishing with your son. Maybe not on this lake, but the one that you usually go to. And he said, I need to go back to my room now. And I said, okay, that's a good idea. And the other turned over with a big smile, and he goes, I need to call my son. So sometimes the words you use in painting a picture or creating an image for people, like imagine what you can do in the near future, or imagine when all this is over. And people do, don't they? Because you know, you talk to your patients and you talk to their families. And as nurses, I think they share their fears, right? And their ideas and their wishes. They share all that with you. And you're kind of that first line of defense, aren't you, that people go to try to feel better about whatever the situation is that they're in. So the words you use are very important in creating feelings for them. And also in their healing. Another way that you heal people is through touch, right? So wherever you're sitting right now, at the table, will you just join hands with the people around you? You might have to move around some. Yeah, if you can join to another table that doesn't have. All right. Now you're holding hands with people. Some people you know, maybe some people you don't know. Okay. Now close down your eyes again. And one person, squeeze the person next to you. Squeeze their hand. And let that go around. So that everybody gets their hands squeezed. Good. All right, open your eyes. And I want you to stand up. Now, this is not a difficult thing to do. I want you to turn around to the people around you and introduce yourself and shake hands with your friends. Well, thank you. So how was that different from when you're just sitting there? It works, yeah. It's nicer. communication with people, that touching people, reaching out to people. We all need each other so much. And so in dealing with patients and families and even each other, you know, I know you have crazy days at work and crazy days, and I think our lives are all kind of crazy. So reaching out and touching someone or saying, hey, I need a hug, or going in and talking to someone. You know, so if we can use each other more to feel better, that's another way to de-stress. What do you do? I asked you how you relax, but what do you do during the day at work when things are frazzled and you're all stressed? What do you do? What do you do now? Go and talk with another colleague? Okay. What I'd like for you to do, I'm going to give you some more homework to do. Just at your table among yourselves, I want you to talk about that. Share with each other what you do to relax. I mean, I've worked in hospitals, and my husband's real sick, and when he's in the hospital, I go around talking to the nurses. And I ask them, what do you do? How do you relax? What bothers you the most? And emergency rooms. In fact, that's how I got the idea for this conference, because I said, what do nurses want to hear about? And so many of them said, I want to know how to deal with the stress of having this job. And so that's why we thought, well, good, maybe people want to know. So share with each other, really talk about some situations at work that happen and how you deal with it. How do you de-stress? How do you make it better? How do you not go home and be all frazzled? You know, one lady told me the other night at the hospital, I said, how do you get over, because it was a really bad day at the hospital. And I said, how do you get over this? And she said, I go home and drink a bottle of wine. Really? She goes, no, I really do. She goes, only on days when we've had a day like this, and I don't have to work the next day. You know, but I mean, there's all kinds of ways. We could probably take hours going through all different ways people relax. You know, but share with each other, because that's the best way. Share with each other what you do during the day at work or when you go home to come down and relax. And try to have that same feeling you got a moment ago when we did the imagery. Everybody was calm and relaxed, your blood pressure went down, heart rate, respiration, everything goes down. But you can't do that all at work. But you still have to be focused and in charge and getting things done and multitasking. So do some sharing with each other. And we'll come back. Here we go.
I do a lot of pushing now. Parents. I think that's the hardest thing. It's not always the patients, it's their families. Pediatrics and geriatrics have that. Especially with these kids, especially with these children, because they hear, I know my sister, and their you have a lot of protection with that. Just letting one know. This is how she was going to sue the and it's a little different from just sometimes looking at walking into a room, know what it is, a patient's room, and just sort of looking
Yeah, I was gonna say that's why you need to go.
Now, how patients
Mine's in the day, so it's actually still like 8 hours. So many I've gotten sick men, like just no calls in the office, and on the other side of the office is infusion. Infusion partners. Those nurses work 10 hours. That's something I need to do. So we're open pretty much like all day. We have like a staff lunch break, we just kind of like stagger.
right.
What did you do? And that's
Yeah, they're going to make
Tuesday,
it.
Wednesday, Thursday, Friday, and Monday are usually like so. Usually sometimes they have one. I just try to bring each interaction. I know I inpatient we're so busy. I'm heading out of a room to tragedy, and then I have another patient who's just as stressed out for a reason, and I have to stop. And like I'll look at the door, stand in front of the door, and then for a second,
Yeah, get yourself
deep breaths, like breathe or focus on what I'm going into, and try to live what I left.
and especially you go home to 2 children.
And I like looking out the window. I love to do that. That's something I do a lot. Just look out in the patient's room. I'll look out the window. Half of our room is very small. The other half faces trees and stuff. But I'm in the pretty room. I'm like, look at what a pretty view you have. And I'm like, can you see? Would you like to come over here with me?
What is the length of Thursday? How many days are they averaging to stay in?
If they come in for scheduled treatments, they'll be there. If everything goes perfectly, 6 to 7 days. That happens about half of the time. Yes. That's about half of the case on the floor. The rest are there.
So they don't go to patient care.
Not the patients I see, because their diseases are advanced, that their outpatient options are to use. And then are in the treatment, and then if they have to go to patient, they start off at ours, and then they get used to the blood work. So I can see their report. And then that's when they work.
Can you wrap up your stories and we'll do something else?
Yeah.
And that's
And then
those courts don't know
There's so many good stories that I went around to the tables and listened to people talk about what they do.
We used to have a
So, but it's a lot of good sharing. And you don't have time to do that at work. You know, you don't have time to get away and do much of anything. But I heard about breathing and centering. You know, the things that we're talking about now people are doing. So, Just some quick tips. These things you can do with the patients and their families too. I mean, like the way you talk to people, like the imagery that you create. One of the important things, and I'm kind of big on this, and I talk to my patients about it all the time, is it's not the situation, it's what you tell yourself about it. So if you think about it, we talk to ourselves all the time, don't we? We're always telling ourselves messages. And so sometimes we de-stress ourselves out, right? By having negative thoughts or telling ourselves, I'm so tired, I'm so worried, I can't get to this, I need help, you know, all the things we tell ourselves. So if we take a moment and say, wait a minute, I'm all upset because of what I just thought about. So I ask people, take that split second and challenge yourself and say, is it the situation or what I'm telling myself about it? You know, I mean, yes, we have to deal with reality, but sometimes that's debatable, what reality is. So we have to try to find a way to not get a lot of clutter going in our head, or saying somebody else should have done something, or why do I have to do it? That kind of thing. Okay. So breathe, and you can teach your patients. Do you do this with your patients? Do you ever tell them, just stop, take a deep breath? Just take a deep breath. Go in and touch them. You know, that kind of healing touch where you just touch someone, not in a clinical way, not because you have to do a procedure or because it seems like the thing to do, but where you actually touch people and say, take a deep breath, I know things are going on, do you have any questions? Is there anything maybe you need clarity on? And how do they respond? They're usually grateful. I mean, people are grateful that you're there. You know, you're kind of like someone they can reach out to when they feel really low. This is really scary. And families need a lot of help too. So, have you ever thought about your relationship with your patients and how intimate that is and how brief? You know, those of you that work in hospital settings or other rehab settings, you see people for a brief period of time, you're very close, you share a lot of things, and then it's over. That's really kind of nice. You handle it well, and you're able to go on. Okay, and then prayer. Prayer is, do you feel okay about prayer with people? Is that okay? Is that something that you do, or that you let people know that you do? You ever go in to someone and say, how about if I pray with you? Or, you know, I was praying for you when you went to that test this morning. Sometimes. I think people are surprised when medical professionals make those comments. You know, just letting people know that you care about them on their spiritual level. It's an important part. And doing it for yourself. How many, you don't have to raise your hand, but how many of you say prayers for yourself during the day? Other than, oh God, help me. Oh God, please do my knees, not hurting. I mean, prayers not like that. Okay. Right, just good thoughts for yourself. Okay. What we did when we did the imagery was called eliciting the relaxation response. If any of you have done that before, you know that. So as often as you can bring about that relaxation response in yourself, the healthier that you are. If you can come back to center, come back to calm, come back to a point where you're not frazzled. You know, you give yourself a chance to be healthier because, you know, stress suppresses the immune system, and when it suppresses the immune system, you get sick. So whenever I get cold or I get allergies or I just had bronchitis, my husband's in the hospital and now he's very ill packed. So I've been really stressed out being with him and going to work and doing those things. And so when one of the doctors came in and said, boy, you're sure coughing a lot, I said, yeah, it's a stress reaction. But it is. Just too much. Catch yourself with it. Okay. Now I'm going to put you back to work one more time. Okay? So if you stand up. And you may have to move away from the tables, but however you can, what I want you to do is form like a little circle with your group. However you can do that, where you can, you may have to come out here, or get in the middle of the room, or form a little circle. You might want to come up here or back there. Yeah, just form circles. Just form circles. You don't have to stay at the table, just form circles.
You want to come and join our circle?
Okay. Yeah, some of you in the back, why don't you come up and get with a bigger circle? Okay? All right, good. All right, now everybody turn to your right. To your right. Put your hands on the shoulders of the people in front of you. And give them a little massage. Okay, now turn to the center of your circle. Just turn to the center of the circle. Okay? Can you reach into the center and touch your hands with everybody there? Okay. And then just slowly, slowly raise your arms. Slowly, slowly, slowly up, 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 up. Just a stretch, just a stretch. Oh, great. Okay. Big breath out and hands down. Check it out. Okay. All right. Okay, go back to the table. So there again, yeah, this sounds kind of stupid. Do you go in and I don't know if nurses have time to do this anymore. My mom was a nurse, and from way, way, way back. And she said, when I started I was director of integrated medicine with the healthcare system. So I believe in that combination of complementary and traditional medicine. And so she died a few years ago of congestive heart failure. And I would go in and I would do the imagery with her, and I would, and she said, honey, we've already done it. That's not good. When she was a nurse, she said, we didn't have all these sophisticated tests and medicines. We just didn't. We had to do what we could do at the time. She said, most of the time when people were in pain, she said, especially women in labor or people with a lot of pain, she said, all we could do was put them in warm water. She said they would get very warm and they would just float. And she said, or we would go in and rub their hands and rub their feet and touch their face. And she said, a lot of times women in labor or people that had serious illnesses, and she said, especially before they went into surgery, and she was trained in the Catholic hospital. She said we would go in and pray with them, and then we would say, and just think about if you were out on a beautiful mountain. And it was imagery. You know, as they were doing imagery, she goes, that's all we had. She said, we didn't have a lot of medicines. We had a few things to heal pain, but mostly it was nursing. It was nursing. It was that caring for someone, that compassion, that, as Dr. Lee said, bringing that joy to them, even just for that moment, whether they were seriously ill or not so ill, you know, and breathe, and breathe. Okay, anybody would take a big deep breath and let it out, and questions. If you have any questions, comments, things to add, all of you have your own wonderful bits of information.
I just wanted to share with you all that I work at the medical clinic. I work in the Compass unit. Compass unit is patients who are 18 to 30 years old, and I lead the meditation group over there every Wednesday. But it's basically not meditational. I feel it's more spiritual, but I don't label it as spiritual. Because my patients are too rich. They have divorced parents most of the time. Parents don't have time. Patients are lost for spirituality, and I feel that's the time I hold them. I give them love. And in my meditation group, I teach them breathing exercise, which is from like yoga pranayama. So I teach them different nasal breathing and breathing exercise that can help them with their anger. And then in the end of the group, I share with them some moral story, you know, that brings inspiration, makes them recognize to identify their motives in life, because many of them are passively suicidal, and brings in the purpose of life for them. And then I do a round robin at the end of the group where say something for your next patient, something positive, whether you know that person or not, but what positive thing you can see. And I feel it's truly blessing, and I have never felt stressed at my work, so I feel my work starts when I go home. So I just wanted to share that with you all.
Good. Thank you so much. That's wonderful. Anybody else have a question or something to share?
I have a comment about, I've heard from several tables, we don't have time for that. But we have time for everything that's important. We're taught over and over again, it's all about priorities. We can love one another only as much as we love ourselves. And it's taking care of the patient to take care of ourselves. And when I was teaching nursing students, I would teach them to take bathroom breaks. Because I remember early in my career, before they had ICD codes and all that, taking care of a patient that had an admitting diagnosis of a nurse's bladder because she hadn't taken time to go to the restroom. So it is about remembering that we are worth taking care of. And it doesn't really take any time to take a deep breath. It really doesn't. You can do that when we're walking. To be intentional about taking that deep breath. It doesn't take any more time to pray when we're pouring up our medicines, to pray for our patient, or to pray for ourselves. It takes no more time. And Dr. Levy was talking about the importance of eye contact. I found out that my morning rounds took less time when I made morning rounds and just looked at the person in the eye and the family members. It must have been hard. It must be hard to be here night after night. I didn't have to say anything, just that, and look at them in the eye, and then I go on. You know? So let's not accept the message we've been telling ourselves we don't have enough time. We have all the time we need to do what we are to do. Amen.
Thank you. Thanks, Karen. Thank you so much. Anybody have anything to add to that or comment on or advice or questions?
Something. I moved into school nursing after doing ER nursing, and I felt like, I was telling the girls at lunch, I felt really alone when I got there because I went from having a team of nurses to being by myself with, you know, hundreds of people making decisions. And I noticed that things got better for me and my decisions got clearer once I started praying before I made them. There's some pretty life and death things at times, like a child who appeared to maybe be heading towards anaphylaxis, or you know, somebody who had a head injury but it wasn't really clear if it was heading towards a concussion. I mean, just things we deal with all the time when you're in the hospital. You know, you have each other and you have doctors. So I just found, well, I was going to have to make God my attending physician, you know, and that has helped me so much. And I've developed the ability to hear His voice in my head, tell me what to do, and it's just made me a better nurse. So, thank you.
Oh, thank you. That's wonderful. You know, that brings up another aspect of how many of you go on or trust your intuition? You do, don't you? It's not something you learn. You just do it, you know, because that's what feels right. Somebody else had something. Oh. Okay. There you go.
I also came from school nursing, and now I'm in infectious disease, TB control. And I don't know if y'all know that, but TB is still a disease that you're looked down on when you have. So a lot of times my patients be real depressed. We put them on home isolation. When they go out, if they do, they can go to the doctor, the grocery store. Really important things, so they have to wear masks until they've been on the medicine for 2 weeks. And we have a negative smear, you know, when they spit in the cup and it's negative for TB cells. But anyway, I find I was doing it and I didn't realize it, but I would be giving them hope. And a lot of times my patient is HIV positive, and then I would tell them, okay, you have this disease, TB, and you have HIV, but we still going to remain hopeful, not helpless. We're going to look that we can be cured. HIV may not be cured, TB is curable. And I didn't really realize it until you were talking. Maybe it is kind of a ministry I'm doing. So I just wanted to share that, because TB is still looked up as a really bad disease, and you know, you stay away from it.
Thank you so much. Well, everything that you guys do, each one of you has a ministry, and you're doing it. It's just who you are. So, all right. Any last comments, questions? Anything? I think our time is up. But I really appreciate you and the work that you do. And so many people do too. Maybe they don't say thank you, or maybe they say thank you, and it's just like, oh yeah, well, okay. But you just, it's just, you're just so important. And I'm going to leave you with this thought. When you think about yourself, and yes, you have a profession, but not yourself, like all one word, yourself. 2 words. Please remember that you are so unique in who you are. And no matter if you're stressed out, no matter if you're joyful, whatever you are, never in the history of the world will you ever occur again. So you're all we have. So please be very kind to you and take very good care. Thank you.